Do you want to save money on your next flight? Then pick up the phone and call. That's right, call, because the best prices are not online. They're with SmartFares. See, SmartFares has special deals with the airlines. When they have unsold seats, they use SmartFares to fill them. So you get airline tickets at ridiculously low prices. Our prices are too low to publish online. With the extra money you'll save, you can book another trip or treat yourself to dinner or shopping. So stop searching all of those travel sites to find the lowest price on your next flight. Let one of our SmartFares expert travel agents find ridiculously low prices for you. Call SmartFares today and get the best price on your next flight. Guaranteed. Also, save up to 50% off business and first class tickets.
855-325-1820. 855-325-1820. That's 855-325-1820.
Fast Track Student Loans can get your student loans out of default, stop any wage garnishments, stop collection calls, and stop seizure of your tax refund. Give yourself a break. Stop the stress and get your student loan payments down to as little as $25 a month based on what you can afford to pay. 800-709-4395. 800-709-4395. 800-709-4395. 800-709-4395.
You're listening to Joco Community Radio.
Well, good evening and welcome to the Reach Across Johnson County segment on Joco Community Radio. You can join us live here on Facebook or download the TuneIn Radio app. It's free. Where we live, we are live 365 on Joco Community Radio, the voice of Johnson County. And to share a little bit about Reach, our mission is to support safe and healthy choices, vital to the well-being of our youth, families, and community. This show will guide you, educate you, and inspire you to be a part of the solution and to reach out and help make a difference in our communities. What began as a local movement in the city of Midlothian grew to include programs throughout Ellis County with only a few short years and eventually expanded into neighboring Johnson County, Texas. And here we are today. And I'm Sherry Phillips. I'm the community liaison for Reach Council, and I'll let my co-host introduce themselves.
Yeah, I'm Jennifer. I also work with Reach.
My name is Ashley Vasquez, and I am the coalition coordinator at Reach.
And we have a very special guest with us this evening. We've got June Dibble. She's with Recovery Resource Council, and she's representing the PRC Region 3 today as well. And to share a little information about June, she is the public relations. I can't talk tonight. Sorry, y'all. She is the Public Relations Coordinator for the Prevention Resource Center, Region 3, a program of Recovery Resource Council. She is also the Coalition Coordinator for Dallas Area Drug Prevention Partnership, a community coalition focusing on the youth prevention of drug and alcohol misuse. For the past 6 years, she has been responsible for promoting substance misuse prevention activities, providing trainings, and conducting presentations to both adults and youth. June has a Bachelor's of Science degree in Health Studies from Texas Women's University and a Master of Science degree in Health Education from Texas A&M University. She is also certified health education specialist and an advanced certified prevention specialist. Welcome, June.
Thank you so much for having me. I'm very happy to be here.
Good. I'm going to have you pull your mic up just a little bit closer still.
Okay, this is very new to me.
I know. Well, it's becoming an old habit to us, but sometimes I forget to pull my mic up too. So again, welcome, and we're so glad to have you here with us. I know this evening we're kind of going to be talking about the regional needs assessment that was done, and we're going to focus on some of the Johnson County data, and then just kind of talk about various things like risk and protective factors and things like that we can do in our community. And so, first of all, why don't you tell us a little bit about Recovery Resource Council for those that may not be familiar?
All right. Recovery Resource Council, we have been in the North Texas area for over 75 years now. We are the largest nonprofit organization dedicated to prevention, intervention, and the treatment of alcohol, substance use disorders, and behavioral health issues. So really our mission is not just the substance misuse, but we want to also to promote wellness, and recovery from alcohol and substance use, but we also want to promote recovery from trauma
Right.
because it plays a big part in behavioral patterns. So we want to make sure of that. I know that this has been said before because I know you've had some guests from Recovery Resource Council before, and one of my favorite things is we have an agency guarantee. This is near and dear to my heart because I think it describes how I would want my personal relationships to be as well. So that agency guarantee is unconditional acceptance, respect, and positive regard.
That's
And
awesome.
would that not be a life goal right there?
Absolutely. Something to
I-
strive for.
I really like that.
Do you know who came up with it?
I
Was
don't.
it like a staff conversation? Okay,
I don't,
Okay.
but it was
I like it.
Recovery Resource Council. We actually we have 3 offices. So I'm going to
Mhm.
get to that.
Okay.
We have 3 offices: one in Dallas, one in Fort Worth,
Mhm.
and one in Denton. So we have 3 campuses: East, West, and North. But several years ago, I was working out of the Dallas office. We were the Council on Alcohol and Drugs, which many people were familiar with. We were a prevention agency, and then Recovery Resource Council was in Tarrant County and serving the western counties, western areas of the Metroplex. And when our executive director retired, she said, "You know what? We work closely with Recovery Resource Council. Let's talk to them. Let's
Yeah.
see. Maybe we want to merge." And so we merged with them, and it's just been the greatest um, strengthening of 2 agencies. The East Campus did some things that they didn't do. The West Campus did things that Dallas didn't do. But that agency guarantee came with the merger. So
Nice.
That's nice.
It's always good to hear when mergers go well.
Absolutely.
So that's, uplifting.
yeah, once we got past the paperwork change, and
Yeah,
having to learn
HR.
new systems, like what I have to do it this way now.
Mhm.
Once you get past that, and it's been exciting to see the growth. We are growing. We we're going to talk about data tonight. We have an opening for a data coordinator. Our data coordinator has been promoted.
Mhm.
So we are we've been expanding even during COVID. We've been adding to our staff because there is a great need for what we do.
Yes.
You know
We
that.
know that. Yep.
But I wanted to tell you a little bit about some of the programs that are with Recovery Resource Council, some of the things that we're really proud of. We're the outreach, screening, and referral system for Tarrant County and surrounding areas. So that OSAR, people can call in and they can be assessed over the phone. So that is available to Johnson County.
Okay.
So people can call in and get that assessment.
Is there a number listed or anything on that?
Yes, it is 817-332-6329.
Okay.
And that is our main number. But reaching our information and referral people there, they can access information. They can give you the assessment, but they can also access information in other counties so that you're not just left high and dry. If you have a need, a concern, oftentimes some of those calls come in because of a person has an individual issue with mental health or substance use disorder, but sometimes it's a family member. They're calling, my father, my son, my brother has this issue, and Recovery Resource Council can help refer them.
So by calling 817-332-6329, anybody can call that. And what would they expect? Just somebody on the other end kind of helping to talk them through.
Right. And
mhm.
refer them to a
Refer.
program that
Okay.
would be pertinent for them. One of our programs is we've got outpatient treatment, and these services are free. We've got an extensive veterans program, both for mental health issues, and we include the families in that. But also there are a number of veterans that are experiencing homelessness or they're housing insecure, and we can help with that. There are programs in Johnson County that we can refer to. I don't have that particular name, but when I called, because I talked to the people in information referral, and I said, "This is what I'm doing. Tell me how this would work." And they were walking me through it. We have, of course, the Prevention Resource Center, which I'll tell a little bit more about in a minute.
Okay. Well, quick question.
Uh-huh.
So in the veterans program, would they call that same main number and they'll direct them then?
They would.
Okay, perfect.
Are those programs on location in Fort Worth, or are these programs can travel like to the person's home in Johnson County?
Mostly it's telehealth. There's in
Okay,
person,
got you.
but then there's also telehealth services.
Oh, great.
You know, COVID was as tragic and terrible as it has been for so many people. There also were things that we learned. There were things that we gained. There were things that new ways of outreach, and telehealth is one of those things that we're able to reach people where they are, and not have them have to come into an office and sit in a chair in front of someone.
It's a big deal.
So, you know, all of our counselors are all EMDR trained, certified. That's the eye movement desensitization and reprocessing, which I really couldn't tell you how that works. I just know that they consider that magic, and it is something that when people are looking for counseling and they've experienced trauma, PTSD, this is something that is well respected in treatment, in the treatment industry, and so it's something that all of our counselors are trained in.
That's
so
great.
I've always been on the prevention side, so I want to tell you a little bit about that.
Okay.
I am working in the Prevention Resource Center, which is the Prevention Resource Center for Region 3. Health and Human Services Commission HHSC in the state of Texas has divided it between 11 regions. And each of those regions has a Prevention Resource Center, a PRC. We represent Region 3. So what is the PRC? You hear the word prevention, you hear resource. We're actually the data repository for everything that's going on in our 19 counties in North Texas, Johnson County being one of those. And so we're the data people. We love numbers. Numbers are very, very important. And I'm going to tell you in a minute how important numbers are. I mean, you have to know what's going on. If you don't, you just have opinions.
You have to know where to start too.
That's
when
right.
you're trying to figure out. Yep.
Know where to start and know what's real and not disinformation. So, so we are the data repository, but we're also, so what that means is that we do surveys, we look for data, we compile the data, and then we analyze and send it back out into the community. Specifically our regional needs assessment, which we're going to go into
a little bit.
Yeah, we're going to go into to that. But we're also a resource. I mean, we're our center, we're able to provide resources to coalitions, to reach, to schools. Any community member, any stakeholder wants to call us and say, hey, this is what we think we're having this problem. Can you help us with it? Or can you give us some numbers about it? Do you see the same thing? What's going on in our community? We're concerned. And we're able to provide that support.
So do y'all direct, so if there's coalitions in certain areas, do y'all go ahead and direct them to coalitions that they can connect to?
Yes, we do.
Okay. Well,
that's
great
part of our services. And we provide trainings, and we'll call up the other coalitions and say, hey, we're having this great training. And,
I know I sit in on a lot of the things that y'all do, and bringing that up real quick. I know that you've got a training. I want to go ahead and kind of just mention it real quick, and then I want to mention it again at the end of towards the end of the show, in case somebody is interested. Y'all are actually partnering with HIDA, I believe, and y'all are going to be doing a program that's going to be called High in Plain Sight. You want to explain that a little bit?
I do. Yes, we do work closely with HIDA. That's, if you don't know what that is, that's HIDTA, pronounced HIDA. And it is the high intensity drug trafficking area. So this is the Texoma division. They handle North Texas and Oklahoma, and it's law enforcement, right? So you think, okay, well, why are they involved in prevention? The director of HIDA the Texoma HIDA is he's very clear in that it's a multifaceted effort, that law enforcement is very important. The drugs that are coming up through up 35, because that's a high intensity drug trafficking. that they're all about trying to stop that. But they also feel like demand is a big deal too. So prevention. If the demand goes down, then maybe it wouldn't be such a problem. And so we work closely with them. So we have partnered with them. They wanted to bring in Tall Cop.
Mhm.
And for those that don't know who Tall Cop is, his real name is Jermaine Galloway. He was in law enforcement for years. And he does a program. He travels all over the country. And he does a program that's called High in Plain Sight. And he trains law enforcement, and he trains preventionists, and he trains just the parent.
Yes.
Right? This is what you need to be looking for from those perspectives. And his such a wealth of knowledge on drug trends among youth, about where hiding places, where how it can be in plain sight,
Mhm.
and we as parents might not even realize that it's right there in front of us. And so he brings clothing items and logos and things that what's the 710, you turn it
Yeah,
upside
the
down, it's
oil.
oil.
Yeah.
I mean, who knew? And you can buy hats and t-shirts with all of this. And so we have to be able to keep up. And so he is coming on July the 12th. He's giving 2 different sessions. This will be in Irving. I don't have this. I literally got the flyer today and did not print it off to bring it. It literally came out this afternoon. It is at the Irving Convention Center, I believe, and maybe
I
we can.
believe so. And I could pull up more
Mhm.
information on that here in a little bit because I do have the email that you sent to me that
Mhm.
that has that information.
So what they're going to be doing in the morning is that he's going to be training law enforcement. So TCOL credits for law enforcement. He's going to come at his perspective for that is going to be an enforcement perspective. And then in the afternoon, he's opening it up to the community, to prevention specialists, to people like us, coalitions and educators and people who are interested in those trends. So you don't go to both; you just go to one or the other. It is totally free. There will be CEUs available for the afternoon, TCOL CEUs for law enforcement in the morning. And so I would urge everybody. It will be on our Facebook pages. I'll make sure that you have it
Okay.
where you can post it. But
Yeah,
people
now
need
it's
to
not coming up.
register.
And y'all also partner with MAD because I know that there was something else coming up with MAD, or did that already take place? The Empowering the Parent type deal.
I am not as familiar with that.
Let's see, what was it? Yeah, the empowering parents, empowering families. Let's see. There's an event that y'all are doing. I'm going to get where I can read it. May the 11th, fatal crashes and fragile humans. What happens to your body in car crashes? And yeah, I saw where y'all actually are one of the community partners. But you sent that out from Emma from MAD.
Yes.
We had her on as a special guest not too long ago.
And you bring up a really good point about, partnering
Mhm.
and about the other organizations. We partner with other coalitions in West Texas, East Texas, because we're serving our communities in our little areas. You're serving
Right.
Johnson County. This is where you want to make this community better. I am the coalition coordinator for one in Dallas. So yes, we're going to concentrate on our zip codes and we're going to concentrate on our initiatives. But we are a part of a bigger community. It's not just Johnson County. It's not just Dallas County. We can't live in a silo,
Right.
and it all affects everybody else. And so that's why it's so important to partner, to collaborate, to get ideas, and really strengthen all of our efforts.
Well, a good example of that is this past weekend's the National Prescription Drug Take Back.
Mhm.
It started out in a small area and then it's really expanded. And so I know that our coalition in Johnson County, partnered with law enforcement here. I worked with law enforcement in Ellis County, and I know that you had a
Mhm.
lot in the Dallas County area. And so, when you think about how much, because I know in my area that we collected 731 pounds just this weekend, for expired and unused medications. And that's getting it out of home medicine cabinets, out of access of those that might misuse them and things like that. And, we all work to establish, ways to safely dispose of your medications and to store your medications and things like that. So, as you said, we as a community, we collaborate with so many people, not only across our state, but across the country. And so it's fun to be able to do that and make a difference in our communities.
It takes a village.
It takes a village for sure.
So my husband has this. If he ever hears this, he's going to be upset. But he said one time, he said, you know what? He said, you're fighting a forest fire with a garden hose.
Yeah.
You're never going to solve this problem. It's never going to go away. And I said, well, maybe, but if enough people have garden hoses, we can make a dent.
We can make a dent.
It might not ever go away, but we can at least make some changes. And so that's what
Absolutely.
it's really about, is all of us with our individual garden hose, giving it all of our best effort.
That's right. I like that. That's a good one. I had not heard that one before, June. So that's a good one. I'll have to keep that one in mind. All right. So let's see. What is our next topic?
I would say the regional needs assessment.
Okay.
Let's get
Let's
down
go
to
ahead and do it.
that.
Okay.
I'm
Perfect.
excited.
So let's talk about the regional needs assessment. This is the big project that the Prevention Resource Center is tasked with doing every year. It is, I know you're all just anxious to read all 247 pages.
And if that really is something people are interested in, they should apply for that coordinator position. Yeah.
I know.
Yeah.
But
they really
the
should.
more I get into numbers, the more
Mhm.
exciting it really is.
It really is.
Because
Yeah.
it tells a story. It
Yes.
tells it, and it also makes you ask more questions. It's like, oh, is that what it is? Is that really true? Why is that?
Why, yeah.
If this is the number, what's the why behind it?
Yep.
So we do publish this RNA, Regional Needs Assessment, every single year over our 19 counties. This is what our big task is. And that's going to include data, statewide data compared to our region, the 19 counties, but also broken down, when we can, break it down into the individual counties.
Mhm.
Now, this year it's changed a little bit, which I really like this change. So every year it was the big push to put out the 200 and something page RNA, and it's all numbers and data. But some people like that. Some people are like, yawn. I'm not going to look at that unless I really need one piece of data out of there. I'm going to pull that out. So HHSC said, you know what? Let's do it, switch it a little bit, and let's have an RNA every other year.
Okay.
And then that in between year, let's have some qualitative data.
Oh,
Yes,
that's good.
qualitative data that you can turn into some quantitative, but let's have focus groups. Let's have some community members that tell us what they're thinking.
Okay.
Key informant interviews, I
Yep.
think, is what our data coordinator would call that. And Kay Hashim is our data coordinator, who is now moving up. So that's why there's an
opening.
An opening. But she is hard at it right now doing key informant interviews.
Okay.
So if anyone in Johnson County wants to let their voice be heard, just contact us at that same number.
Okay.
That same phone number, 817-332-6329.
Okay.
And we can add them to the list, and Kay can contact them for a key informant interview.
So that could be like some of our stakeholders in our community and
Mhm.
things that they see. And so it could be a law enforcement officer, or it could
Yes.
be a nurse at or hospital or one of the
Mhm.
clinics and things like that. Okay.
And so and as coalition professionals, one of the things that we talk about is the 12 sectors.
Mhm.
And so she wants to have people in the different
different
sectors. So those
sectors.
sectors would be like law enforcement, would be
Mhm.
healthcare, would be educators, would be nonprofits, civic organizations like your Rotary
Faith-based,
clubs,
yep.
faith-based, media. So those are things that there's 12 sectors.
Mhm.
If I had to,
We don't have to
don't
name-
make
no,
me
we will
list them
not.
all.
Well, and of course there's
Nope.
parents and
Parents.
youth.
Other organizations.
Other
that serve
organizations.
youth.
Yeah. because everybody needs a
Recovery
voice.
community, treatment community.
Yeah.
Everybody needs to be a part of the solution.
Absolutely.
They all need to be holding that garden hose.
Absolutely.
I'll even put your name on it. So that's going to be the every other year, and we're really excited about that change because I think it'll change what we offer our communities. But when we talk about the numbers and we talk about, what its use is, so why? Okay, so it's great that you're publishing this 247 pages regional needs assessment, but so what? Why is that important? It's important for organizations like yours who might, or a school or some other organization, or maybe even just a group of parents who say, you know what, we think there's a problem here. Is there really a problem? I know way back when, because I'm older, in the 70s, that was when marijuana use, weed was really popular. And it was not like the weed of today.
Right.
And I went to a small school they were very upset that that some of the students were smoking cigarettes in the stairwells. And so they came down hard on this, they were going to punish people. They were going to have all this education. And I was thinking to myself, they don't have any clue that everybody's in those same stairwells and they're smoking marijuana.
Mm-hmm.
But yet the school thought they had a different problem, and that's what they focused on. And I thought it was kind of funny at the time. I mean, I was in high school. What did I know? But I did think, you've missed the boat. And so we want to make sure that this RNA allows people to not miss the boat.
Yeah.
Don't miss the focus. Have the information.
Plus, you can't bury your head in the sand that there's not problems going on in your community. I mean, there are problems. We would like to think that we live in a perfect place, but unfortunately, times are changing. Things become attractive to kids and others, and a lot of times, criminal activity. A lot of that kind of focuses around substance misuse, alcohol and things like that. And so there's a lot of different things that tie in. Mental health, that ties in huge. So
Socioeconomic.
Yes.
It's a big one too.
It's a big one. Yeah.
Everything's related, and it all ties together. I think one of the phrases that I heard was that everything's layered, and we can't dismiss one thing and say, oh, well, that doesn't have anything to do with it. It has to be, more, it's all tied together.
It is. Yes. I know that, in coalition work, we always, we're fixing to go to commercial break here in a second. So
we'll actually have some numbers.
Yeah, we'll have some numbers when we come back.
Jen can't wait for those numbers.
Jen likes her data.
This is a good pre-discussion.
Absolutely. So y'all come back and join us for the second half here shortly, and we'll have more information for you about Johnson County and what the numbers look like.
Accelerated Graphics and Signs, 101 East Renfro, Sweet C in Burleson, Texas, can handle all of your graphic needs. Need a banner or promotional products for your business? They got you covered. T-shirts and caps for your group. All you need to figure out is if you want them screen printed or embroidered. How about some slick graphics on that hot ride to make you stand out from the crowd? Accelerated Graphics and Signs can handle anything you throw at them. Located at 101 East Renfro Street, Sweet C in Burleson, Texas, go in and see them. Call them at 817-991-0523 or reach them on the web at www.acceleratedgraphics.net. They are loud and proud and want to serve you. Accelerated Graphics.
Out-of-date carpet giving you the blues? Tired of your old dingy and broken tile? Let my friends at the Floor Store in Cleburne, Texas give your home the makeover it deserves. This is Old Taco Joe coming to you for the Floor Store. Whether it's carpet, tile, wood flooring, or real wood laminate, the Floor Store can cover all of your flooring needs. Located at 405 West Henderson Street in Cleveland, Texas, owner Brent Harris can help. Shower tile, tub surrounds, even backsplashes. Give them a call today at 817-641-9444. The Floor Store. They've got you covered. When you're hungry for tender brisket or some delicious homemade cobbler, then look no further than Leach Brothers Barbecue, located at 1106 East Henderson, Cleveland, Texas. Leach Brothers has been family owned and operated since 1950. Take it from me, Taco Joe Orwinski. Todd and his family have been filling my belly breakfast, lunch, and dinner for a long time. Heck, I even have my own booth, open Monday through Saturday, 6 a.m. to 7 p.m. Come see them for dine-in, carry-out, and all your catering needs.
You're listening to Joco Community Radio.
Welcome back to the second half of Reach Across Johnson County segment on Joco Community Radio. Joco Community Radio is proud to be the voice of Johnson County, Texas, and is live 365 on the TuneIn Radio Network. To listen or watch, simply go to tuneinjoco.com to choose where and how. The Joco Community Radio app is now available for free on Android and Apple devices. Simply search your store, check out our lineup and more on jococommunityradio.com. This episode and more is brought to you by Patriot Claims, making your insurance work for you. Reach out to your Texas sales rep, Nona Reed, at 844.tex.hail. That's 844-839-4245. And we want to thank Nona for being a sponsor for the Reach Across Johnson County segment and the Joco Community Radio. And if you're just now joining us, we've got June Dybel here. She's with Recovery Resource Council, and we're talking about the needs assessment that is done every other year now. And, talking about the data that's done and what it means and how it affects our communities. So is any particular question you want to start with, or do you just want to start sharing some of the data?
I'll just start giving
sharing.
you some of these numbers.
Perfect.
And then y'all can jump in.
Perfect.
So one of the things we divide the regional needs assessment, the RNA, into different domains. So I'm gonna list some of how those are categorized. Not go into too many specifics, but I want to give you some numbers and where those fall. One of the first things that we do is what's the demographics? Who lives in your community? Who is it? Males, females, ages. What are the races, ethnicities that live in your community?
Mm-hmm.
So the 2021 estimate is that, now this is really interesting. 26.6% of the population is 0 to 18 years old.
And this is Johnson County numbers.
Johnson County.
Wow.
That's huge.
So this is the second highest in Region 3. Dallas has more kids under the age of 18, Dallas County, but then Johnson County is second.
Wow.
And that's been true for the last 2 or 3 years.
Oh, that's good
maybe longer,
information.
but I only checked for the last 3 years.
Okay.
So 26. So that's more than fourth. So more than 1 in 4. But then on the flip side of that, 16% are 65 years and over.
Is that also high?
That's also higher than Texas and higher than the region. Yes.
Oh, wow.
So, and I guess why it's important to know that, because you think, oh, well, we're only concerned about the youth, but when we also concentrate on the parents, which are probably going to be under that 65, but then there's quite a number of grandparents. What kind of influences do they have?
Okay.
And so that's why that number is also
Rather
important.
Yeah.
Here's another interesting demographic. And this is much lower than what Dallas County would be. Dallas County, this is the number for multilingual families.
Okay.
Also, they speak a different language at home other than English. And so in Dallas County, it's very high. It's 41%, so almost half.
Wow.
But in Johnson County, it's 16%.
That speak another language.
That speak another language at home. And so then that begs the question, are you reaching those people? Are you reaching those parents? The kids probably are bilingual. They probably speak English very fluently, but we don't know that their parents do. So how do we communicate with them? How do we get them the information that they need to be the best parents and the best influence on their kids?
Do we know if the other language is Spanish or if it's something else?
I'm going to guess that it's Spanish.
Okay.
Somewhere I have the demographics and I looked at it. Okay, yeah, 70% white alone. These are
Okay.
races. 23% Hispanic, 3% Black alone, less than 1% Asian, and 3% identifying as a race other than listed.
Okay.
So I'm going to guess that
It's
means
probably Spanish.
Spanish.
Okay.
I know there was a coalition that we worked with that they had a large Vietnamese population, and they reached into that community to make sure that they were providing services. So it's always something to think about.
I know for us that we try to provide a lot of our flyers and information both in English and in Spanish, for that purpose. That way, it does, have a broader reach.
Mm-hmm. It's so important because we don't want to exclude it. We want to be inclusive. We want to not exclude people from getting the information that they need. I've done presentations where, I don't speak Spanish. I should. I grew up in Texas. I should have learned it, should know it, but I don't. But I've been in presentations before where, half of the people in that were participating were all Spanish speaking only, and yet they still showed up.
Yeah.
They were wearing headsets and they had an interpreter in their ear, or they were getting it some other way, but it was harder for them. And I walk away from that thinking, I'm so impressed. They care so much about their kids and they want to make sure. So if we can make it easier for them, that's important.
Okay.
So let's talk about other numbers. Income. So this is 2019 numbers. Approximately 1 in 3 households in Johnson County had an income below $50,000. So that's 36.8%. The median household income was a little over $64,000, which is not too bad. But there's still that part of the population that has a very low income.
About a third. Yeah.
So unemployment rate in Johnson County increased significantly from 2019 to 2020. From 3.2% to 6.5%. It'll be interesting to see how that changes over the next year or so.
If it increases again, now that things are a little bit post pandemic. Okay.
Right. So we want to be watching that. And then 60% of students in Johnson County were eligible for free or reduced price lunch. So that may go back to that income level, the 1 in 3 households. Earning under 50,000. So that's societal domain. If we want to talk about community domain, this is more stats about your community, what the picture is.
Okay.
21% of adults in Johnson County do not have health insurance.
Oh.
So this is health insurance also is going to be mental health insurance.
So I think what I'm hearing about domains is it's things that are affecting people other than their own decisions. It's basically how your society is affecting your well-being.
Yes.
It's kind of what that sounds like.
I love that.
So these are
Thank
other
you.
ways. Well, thank you, Kay. I listened to her presentation. I had to try to get my head in this. I listened to like a mini presentation she gave once, and that just brought that up. Like, oh yeah, it's like these are not other people's decisions. These are your risk or protective factors outside of yourself. Really.
This is just what's happening. This is the snapshot.
Mhm.
So, one of the things I thought was interesting, and we're going to talk about alcohol, and I may just kind of branch off here and talk
Okay,
about
this-
it, and then we can go back to
Okay.
numbers. But here's what's really changed between 2018 to 2020: the number of alcohol permits in Johnson County. Now, you tell me. Is there just a huge influx of new retail, new liquor stores, new convenience stores? Because here's the rate: 69.9 per 100,000 people population. That was in 2018. 69.9. It's a rate. In 2020, it was 115.3.
Oh,
See what I mean?
Gosh. Are you serious?
So Johnson County is growing.
Okay.
So that could be part of it.
Part of it.
Mm-hmm. Would I don't know, the alcohol to go during the pandemic do anything about that? Okay.
And
yeah, that's
okay.
big.
and alcohol was always it was an
Mhm.
essential business. They didn't shut down.
Yeah.
And there are memes and jokes and everything. We might not have had toilet paper, but we had a refrigerator full of wine.
Mhm.
Yeah.
And so alcohol use nationwide, alcohol use really went up. And we saw just in Recovery Resource Council, our calls increased with people who were struggling with their recovery. They had been in recovery, they'd been sober, and yet it was so stressful to them, and it was very hard for them to stay on track.
Yeah.
Everything was in flux.
Well, and you needed a way to separate your day. Like
Mhm.
personally, like after 5, it's like, okay, I'm in my house still. Like, let's have a glass of wine and relax. And that's how between sometimes the workday and the just
In
like
the evening,
now I can watch
winding down.
Netflix and wind down or like phone a friend, right? And it's just like it became so much like instead of a commute home or some music in your
Mhm.
car or something like that, that became a bit more like normalized in
Yeah.
a sense. So
But then it became 4:00, and then it became 3:00.
well
and there was never a Friday because all of the days you could just rename them
Mhm.
Blur's Day.
Oh.
They were all just Blur's Day because they all blurred together.
Mhm.
One of the things
Yeah,
on
you
that,
could take it far.
Yeah. well, one of the things that I've noticed recently too, because I do read a lot of different articles, is coming out of the pandemic, some of the studies that they've been doing, alcohol did increase, quite a bit in use and things like that. But now they're really starting to focus on those studies about, the relation between alcohol and the various cancers and things like that. And so, which I found really interesting. One of the trainings that I went to early on when I got into prevention, they were already talking about the correlation of alcohol and breast cancer in women.
Mhm.
And I thought, I never thought about alcohol causing cancer. And I mean, there's been so many more studies, but I mean, there is a big relation. And so I've been seeing a lot more articles that are being released here recently doing the study. And a lot of it was talking about coming out of the pandemic. There was such an increase in use in our adults. And, when you think about it, it's probably like not just our adults. I mean, our kids mimic us. If they're at home and say, for instance, a parent was still able to go out and work and things like that, that access is there. And if you aren't a parent that actually monitors your liquor cabinet or the beer or the wine in your fridge, who's to say that somebody didn't, maybe help themselves a little bit?
I have a funny story about that.
Do you?
I do. So I'm going to tell y'all in a minute about the Texas School Survey and what that is. But their latest, the 2020 Texas School Survey, it surveys kids about their consumption habits and attitudes. And for all grades in our region, the age of initiation, the age that these children and their children reported that they had their first drink, not a sip, but a full drink, was 12.7.
Oh,
That's for all grades.
that's junior high kids.
It is. So here's my story. So my daughter comes to me, and this kind of goes back to communication and what was going on in her life. So she comes to me and she said, "I've got a problem." And I said, "Okay." And she said, "You've got to get rid of the beer in the refrigerator." And we have a second refrigerator. It's in the
garage,
utility
yeah.
room, and my husband doesn't drink a lot of beer, but he loves Costco. So if it's in a big if it's in a big package and he feels like he can get a deal, he is buying it. But then it sits in that refrigerator, and maybe on a Sunday afternoon, maybe during a game or something, he's going to pull out a beer or two and he's going to drink it. So my daughter comes to me and she says, "You got to get rid of that beer." And I just kind of went, "What?" And she was about 12 or 13.
Yeah.
She was in that age range. And she said, "You need to get rid of it because my friends want to come over here and they want to steal it."
Oh my gosh.
And so I thought, so I could have freaked out, right? It could have been, who was that? I know who that was. That was that so-and-so, and she's never going to come over here again. But I just kind of took a deep breath and I thought to myself, okay, thank goodness that she's telling me, she's
Yes.
communicating with me. She felt free to come to me with a problem. Mom can solve this. Because really in her mind, what she wanted was people to just come over and watch a movie on Friday night, sleep over and, do the things that preteens do.
Yeah.
And so having someone only want to come over and not see her, but to steal our beer.
Yeah.
So we kind of changed all that. And then we also had a cabinet that had liquor in it, the bourbon and the whiskey and vodka, whatever's in there. And so we had an alarm guy come in, and it needed to be, our system needed to be upgraded for our insurance policy. And so he goes, yeah, I got these extra sensors, for your windows, your doors, and we didn't need any more. And I went, wait a minute, can you put that sensor on that cabinet over there? And
Oh,
so,
smart.
so he puts this little sensor on there, and so every time you open it, it goes ding, 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 and you think, okay, then I know who's opening. I know that somebody is opening that
liquor cabinet.
That liquor cabinet. So the dog freaked out because he thought it was somebody coming in the front door, and he got really excited, like, oh my gosh, I got to protect the house. But it would open and ding, ding, ding. So, but I'm telling the story to someone, and they said, yeah, but when you're at work and your kids get home from school in the afternoon, it's 4:00, and they're going to get into that liquor cabinet, and it's going to go ding, 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 and nobody but the dog is going to care, right? And I said, yeah, but it text messages me.
Oh,
And
that's smart.
so I know, but it's true, because our kids are at risk. And so how can we help them? How can, in her situation, she could go back to her friends and say, oh, my mom's got this alarm system on our liquor.
Yeah.
And so it solves that problem for her. She
Yeah.
didn't have to deal with that kind of pressure. And so I, you don't have to go to that kind of extreme, but it actually was free for us. I just, the guy was out there. But to do something like that, to lock the cabinet, to make sure you know what you have.
And you gave her that out. That way, if, she was pressured by her friends or whatever, I mean, it's like, hey, my mom has this alarm that'll go off, and it takes her, that somebody's been in the cabinet. And then, as you said, even just sometimes just removing it from an area that's accessible to kids and things like that, that takes the burden off of it. And I want to say kudos for your daughter talking to you, because there's a lot of kids that don't talk to the parents. And so it's real important that our parents talk to our kids about these situations if they were to get into something like this.
Yeah. So is alcohol one of the more, like in Johnson County, would you say that's the most used substance for our youth still, or?
All right. So here's the problem.
Okay.
So the Texas School Survey is given to schools. It's run by HHSC funds the Public Policy Research Institute out of Texas A&M, and they have this survey that is sent out to selected schools in every county all around the state. So they get Texas data, they get region data, and then they get county data. And some schools can even get it drilled down even to their school district. But the schools have to agree to do it. And so for a while, we were not getting good Dallas County. I mean, how many schools are in Dallas County?
Yeah.
And we weren't getting good data.
So it's North Texas.
It's North Texas
data that we have. Okay.
And so our region we've got, but that's why I really want to stress to you and to your schools, any educators, this is information you need. Data matters. The
It does
numbers
matter.
matter. And so by participating in this anonymous survey, takes one health class, in one particular day to take this survey. And so what the survey does is 7th through 12th grade, and it's going to query the kids, on the students, on what they're using. Have you ever used this? How often to use that? Have you used it in the last 30 days? And it's all kinds of substances, both legal and illicit. But then it's also going to ask about attitudes. If you had a problem with alcohol, if you had a problem with substance use, who would you go to? Do you think your parents would care? I mean, that was really telling, is to see in the surveys, some of the things they said, yeah, I think all my friends do it. All my friends use. That was when that's not true. We know from social norms campaigns that that's not true. But then, do you think your parents would think it's dangerous for you to use this substance? And to see where that fell in there. Do you yourself think that it's dangerous for a kid your age to use this? And it's interesting to see. And what's happened with marijuana legalization over the around the country, it's being legalized in other states. So now the perception of harm is going
It's
way
going
down.
Mhm.
And so we're seeing that in the Texas school survey is even though it's not legal in Texas, the attitudes are, nah, it's really not that risky. And so that's a change in attitude. So where do we as prevention specialists, how do we combat that? How do we make sure that they have the knowledge?
Right.
And it goes back to what you were saying about we know more now. We
Mhm.
know more about alcohol and marijuana and because the studies are there. So how do we make sure that we get the information to them?
And as June said, it's very important that, this data is what kind of drives our coalition a lot of times because it informs us what areas we need to work on and to where we
Yeah,
can be
what to
more
focus on.
specific,
Yeah.
to help in our schools or in our
Mhm.
communities and things
Yeah.
like that.
And I mean, we do a lot in our coalition with prescription drugs.
Mhm.
But what if that's, I mean, and it's an issue, and we know
Mhm.
it's an issue. We have like stories, qualitative data, I would
Mhm.
say, for definitely why it's an issue. But sometimes I look at the quantitative data, and alcohol is usually a much bigger issue,
Mhm.
but it's not as, I don't know, trendy to care about, or it's just so normalized,
Mhm.
maybe. There's a bazillion reasons, I'm sure, but that's really all I had to say. Like the data just really
Yeah.
kind of refocuses us
Mhm.
on where we maybe should be spending a bit more of our time.
So
Well, it's
let
kind of like that. Vaping, when vaping took off, we were getting calls from our school districts like, there's this new thing that's going on, and our kids are being bombarded, and they're
Mhm.
getting addicted to nicotine, and what can we do? And of course, being preventionists, we start rallying and trying to figure out what we can do. But again, unless somebody comes to us with something specific, unless we have the data from the survey. That helps us, guide us a little bit more.
okay, so here's data
Okay.
about
Right.
specifically about that. So for vaping and tobacco, and they're separated.
Mhm.
18%. These are all 11th grade students that we've pulled out of the Texas school survey. This is in regions 3 and 4. So this is North Texas and a little bit east.
Okay.
Because again, we didn't get all of the number of schools that needed to be
able to do it.
Yeah.
Mhm.
But 18% of 11th grade students answered not very or not at all
Mm.
when asked how dangerous it is for kids their age to use vaping products.
Wow.
18% just, it's not that dangerous. They don't see it as, and they're consumers of advertising.
Mhm.
And that's what big tobacco wants them to think is, this is not a big deal.
Right.
It's
It's better for you.
It's better for you,
Better
right?
than cigarettes.
Yeah.
No, it's not. But
It's not. But yeah.
Yes.
But you're right. That's
Mhm.
the message that these kids are getting. That's out there. And marijuana and things like that. They're focused on these kids and they're
Mhm.
the candies. If an adult's going to use marijuana or the THC and things like that, they don't need the colorful wrappers and
Right.
things like that. So why focus, that on our kids? So we, as a coalition, we need to stand up and say no more.
Mhm.
They don't need to be advertising to our kids and making this, to where kids have or won't access. And you think about our smaller kids, they see it and think it's candy or something like that, and then could experience an overdose or who knows what.
Mhm. And we get a lot of our data too from the Texas Poison Control.
Mm-hmm.
We collaborate with them on different events, and they're a wealth of information. But there is, documented cases of kids getting into, gummies that look like candy,
Right.
and they're basically poisoned by,
It's
the
toxic.
THC.
That is a toxic.
Okay. So we're down to our last 3 minutes. So let's see what else we've got.
Okay. This is another number that I think is important because I could go on and on about all of this, but I think this is another. I kind of touched on this that, do they think it's dangerous? Do you think it's a problem? But when they asked who would they go to if they had a drug or alcohol problem, if they needed to talk to someone and they needed help, more than 80%. This is Region 3. 80%, that it was actually 82.3. 82.3% of students said, nope, not going to talk to anybody.
Oh my gosh.
Not going to seek
That's
help.
scary.
So that leaves another 17.7% of students, and it was multiple. They could choose different ones. So would they go to their parents, their friends, a doctor, another adult, and the two top where they would go to parents or other friends. 68% of that 17% said that they would go to their parents.
Wow.
But over 80% they wouldn't.
No,
They would
Wouldn't
just
go to
no.
anybody.
Okay.
And so that also is, are they afraid of what their parents will do?
Mhm.
Are they afraid of the reaction? And so we as adults need to step back and say, my child or this child
Mhm.
is reaching out to me because they have a problem. And
Mhm.
how am I going to help fix this?
It can get really punitive really fast
Right.
sometimes when people do that. Yeah.
Right.
So
And that's not what we want to do.
mm-mm.
We want to help them lead better lives.
Well, June, thank you so very much for coming in and joining us today. Let's go ahead and list your number again. So if somebody had some questions for the PRC3, needed resources, we know that they can always contact us at Reach Council or Reach Across Johnson County, but let's share a recovery resource in the PRC.
817-332-6329 is the phone number. That
Okay.
reaches all three campuses. It's a main switchboard.
Okay.
When they transfer you to my phone, it's going to be, I may be out in the field, but I'm going to immediately get an email. We all get emails that somebody has called and left a message, so don't let that discourage you. Our website, the main website for Recovery Resource Council is recoverycouncil.org. And the PRC's website is prc3.org. And you can follow us on Facebook. You can follow us on Twitter. Any way you want.
Anyway, okay.
Yeah.
So if you're listening, you want to be a part of a coalition. If you're in Johnson County, reach out to us at the Reach Across Johnson County. If you happen to be listening in the Dallas County area, share that information.
Our website is drugfreedallas.org, or you can reach us at that phone number.
Awesome. Well, thank you again for being with us this evening. We appreciate you coming in studio. We always love it when we have guests in studio. It's a lot more fun that way. And thank you for tuning in to the Reach Across Johnson County segment on Joco Community Radio. We'll see you next week.